Aurora, knocking on.
Well, I just did the state of the county, so that should give you a good idea of how I see things right now. I do think the transition to charter government has gone well, and I've spent a lot of time in the first 6 or 7 months really trying to build relationships to make sure that charter goes well. So that includes building relationships with the council. So I do meet every week with the council president and vice president to talk about what's happening in the county. I've tried to build relationships with people at the state level, our delegation, as well as cabinet secretaries. So I have met with a number of the individual cabinet secretaries, not all of them. I do have the Secretary of Transportation coming up in about a week or so. And part of that discussion will also include a little driving tour where we'll make sure he sees our transportation needs up close and personal, because he is from out of state, so I don't think he's familiar with the state of Maryland. So I think he has, that will be beneficial. I have actually convened meetings of about over 20 government and non-government organizations that are responding to the heroin epidemic. So we last met in May, and really I want to make sure that I didn't really want to create a new committee and just layer things on, because there's already enough committees. So we're meeting quarterly to just update each other on what we're doing and help coordinate, collaborate better, and to identify where the gaps are. And heroin, a lot of the discussion about the heroin epidemic has focused on the law enforcement side, the public debate, and the use of Narcan or Naloxone, whatever it is. I'm getting mixed up here. Naloxone to prevent some of the deaths, and we are seeing a reduction in deaths this year, and that may be part of the reason why. But the biggest gap is really in substance abuse treatment, and we really we don't have a detox center in Frederick County, and we don't have enough capacity within substance abuse to provide the treatment. I think Dr. Brookmeyer, who is incredibly creative. I can't say enough about Dr. Brookmeyer, our health officer. I mean, her budget is at the year 2000 level, and she continues to really try to meet the needs of the community. So she's come out with this peer recovery coach program, and it's really, from my perspective, modeled a lot in similarity to Alcoholics Anonymous, where you have a sponsor. And it really gives somebody, to be a peer recovery coach, you have to go through a training, you have to have had a substance abuse problem yourself or be a family member. And then that is your link to help connect you to services, and to have somebody to call if you're having a challenging time, and somebody who will understand your circumstance. And she's put a person into the hospital, into the ED, the emergency department, to try to connect to people in that way. And that immediately, the demand was more than the service. So she could use probably 4 or 5 people in the emergency department to really meet the demand of the people that are coming in there. So just the capacity to address it is the biggest problem. So I think we know a lot about what the problem is, and we know a lot about what we need to do, but we just don't have the capacity to do it. And that's a statewide issue. Substance abuse in the jail certainly needs to continue, and we need to have that follow-up as people depart. So lots of subset issues, but I think we're trying to collaborate and do as much as we can.